Hi, everyone. Sorry, we're a few minutes late here. We ran over a little bit, but thank you for being here with us for this briefing on February 3rd. And we will jump right into the numbers like we normally do. It's shocking to see, 36,000 plus individuals who are positive in this county, confirmed cases. But the more shocking number to me is the 395 deaths that we've had as it related to COVID. I just never thought that we would be at this point, and that number obviously continues to grow as we're in this surge. But the good news is the numbers are starting to decline as far as those that are hospitalized. If we can go to the next chart here. Thank you, Ellie. I mean, the real encouraging number is the 122. Remember, 2 weeks ago we were at 180, and we're just on the cusp of really having no beds available, and looking at creating more beds, more surge beds. And so that number is good to see. Hopefully that'll continue to come down, and that is what we are seeing. That's what the trend looks like. So hopefully we are beyond our darkest days, but that will depend on how we react to this. If we go back and start meeting again and getting in groups again and having Super Bowl parties, obviously that number could reverse very quickly and go back up. So we're just going to ask everyone to avoid that. Even if you have a vaccine, wear that mask, socially distance, and obviously we're trying to get that vaccine into as many arms as possible, but we just don't know enough about the outcomes, and it's going to be important for everyone to really continue to adhere to those social distancing and wearing a mask and cleaning their hands and making sure they just use safeguards and stay out of the group meetings. I know everyone wants to get together and celebrate and make up for lost time, but the end is in sight. Let's cross the finish line together. And not get out in front of it and keep everyone safe. We don't want any more deaths, and obviously all deaths are tragic. That last death that we see at the end of COVID is going to be even more tragic. So let's try to keep everyone safe and healthy. Let's talk a little bit about the testing that we're going through right now. And I think a lot of you have known that, or know now that we have moved some of the testing centers. We are no longer doing testing at the event center. It just got too crowded with the amount of vaccine distribution going on there between a provider and the county's drive-through vaccination, mass vaccination program we have going there. So we have moved Optum up to CSM. They are open, the College of San Mateo, they're open 5 days a week. And I'll go through where everyone's at in a minute because a lot has changed. We've also increased testing days, going from 1 per week to 5 days a week in East Palo Alto, North Fair Oaks, and San Bruno. And then, of course, we've got the ongoing testing 5 days a week with 2 providers. Actually, so 1 day a week, 2 providers or 2 different locations. Optum has the bus up there that moves around and tests folks, and then Curative is up there 5 days a week. So we've got a lot of testing going on, despite what you might have read or heard about in the Mercury News. Their data was not lined up correctly. We are consistently between 1 and 3 in the state in testing, and that was since corrected. But we're doing a great job on testing. So just by some of the numbers, College of San Mateo, we had 765. In Daly City, we had 1,600 through Curative. East Palo Alto, 169. And again, that'll increase as we go to 5 days a week. East Palo Alto, Home Depot, 369. The Event Center, 2,100, which was gone away now. And then in the mobile sites that will become more stabilized, we had about 4,000. So moving forward, the testing sites, Optum at College of San Mateo, Sunday through Thursday, 7 a.m. to 7 p.m. drive-through. We can do 1,000 a day up there, and that started on January 25th. Curative in North Fair Oaks, that'll be Monday through Friday, noon to 7 p.m. And a drive-through, and then on Saturday, 10 a.m. to 4 p.m. walk-up. So they can do 1,000 tests a day there. Excuse me. That started 2 days ago, February 1st. Optum. This is a state-sponsored site, excuse me, in East Palo Alto at the YMCA. And that will be Wednesday through Sunday, 7 a.m. to 7 p.m. And that will be drive-through, and then 300 tests per day. And that started 1/27. And then HR support is another vendor we're using. Excuse me. The Church of Jesus Christ and Latter-day Saints at Sneath Lane, and that will be 5 days a week, Tuesdays through Saturdays, 9 a.m. to 5 p.m. So we're doing a lot of testing there, also 1,000 a day. So Curative is also up in Daly City and doing drive-throughs up there. So that'll be 5 days a week, and then Optum is up there 1 day a week. On to the framework for a safer economy and the blueprint for a safer economy. So remember that what we've got to get to, we're in purple right now. In order to get to red, we've got to be at drop below 7 on our adjusted case rate. Right now, we're at 17.9 on the adjusted case rate. So we've got a ways to go. And I'm getting a lot of questions about how do we get to red? How long will it be? Well, we've got a ways to go, because we've got to drop below 7. We've got to be there for 3 weeks, at least in the current framework right now by the state. We've got to be there for 3 weeks. So we've got a ways to go there. Oh, thank you, Connie. So we've got a ways to go. But the good news is on the positivity rate, we're there now at 5 point. You got to be between 5.0 and 8.0, and we're at 4.4. So that is good. That is our average rate on positivity right now. And then on the health equity metric, we still have a ways to go. We've got to be between 5.3 and 8, and we're at 11.7. So we want to see those change over time. The unadjusted case rate has come down dramatically. Also, we're at 31.4. Vaccinations. So as of February 2nd, 2021, 67,292 residents of San Mateo County have been vaccinated with at least 1 dose. This is 10.5 of the population eligible for vaccine currently, those 16 years and older. And this also includes 23% of the county's population aged 65 or older. So a lot of people, again, ask us, the event center, what's going on? We're targeting those in the safety net programs right now at the event center. We are continuing to work with those 65 and above in those safety net programs and IHSS workers. So this is the county charge. We have partnered with Dignity out there in the past, and it was a great effort. And we hope to utilize that facility 7 days a week when the doses, ramp up. And we're hoping that will be at some point soon. Look, we could go 7 days a week in multiple sites. We're prepared to do that once the doses get here, but that is not the case right now for sure. We're still measured from week to week and really trying to understand the allotment for each week so we can plan better. And of course, we need time to outreach to our folks to get them set up for appointments. I can tell you that in the near future, we are and will be contracting with a vendor on a call center that will be able to take incoming calls and do outgoing calls as kind of a concierge service for those in our plan that we're charged with from the safety net population. So we'll be able to help them arrange appointments, potentially arrange transportation, get them to the nearest site, make sure that they have a family or friends who remind them, and constantly be that reminder in order to get as many folks as possible that we are charged with. And this is where equity comes in. Again, those are the safety net services are in the program are the ones that we're responsible for, and that's the ones we are targeting right now. Now there's 40,000 or so, and Sarich can maybe talk to this more at the end, that fall in between that really have no healthcare provider, we will be reaching out to them also and trying to take care of that. So for the clinics next week, let me just find that and give you the information on that, where we'll be doing work the next week. And that is, this week we're at the clinic. We're doing Wednesday through Thursday. Wednesday through Friday, we have clinic going on at the event center, February 3rd through the 5th. And that's, again, IHS workers, HPSM, the Health Plan of San Mateo, 65 years and older. These are folks that we have outreached to, and we were expecting to get about 2,000 a day there. February 8th through the 11th, the Event Center Mass Vac Clinic for those individuals who received their first dose back in January. So we expect to do over 9,500 during that time period there to get folks their second dose. And then February 13th through the 14th, the Event Center Mass Vac Clinic in participation with Dignity Health. This is the second dose clinic for the 4,500 individuals that received their first dose weeks back. We are in the process of bringing on a vendor. You remember as we were doing our mass vaccinations, we're having to pull healthcare workers out of public health. And if obviously they have different duties, that is not sustainable. We're looking to bring on a vendor to run a turnkey operation for us. And that will be the model that we utilize in the future. So a lot going on in that regard as to more vaccinations. And again, we can ramp up. And of course, our goal is, by the end of June to get everyone vaccinated. But that is dependent, and that has always been dependent on getting the doses necessary to do that. And we can ramp up and do that. Right now, we're not close to that goal with the doses that we're getting. And this is not a San Mateo County issue. It's a statewide issue. It's an issue throughout the United States on the amount of doses that we're getting here in the state and then being distributed to the various vendors. And remember, for San Mateo County, it's not only the fact that we're vaccinating people, but we're giving doses out. And we're acting, as that multiplying force. We're giving out to Ravenswood and to NEMS and Gellert and Planned Parenthood and others, and then doing it in the clinics also to others, so they can vaccinate those within our safety net services also. So it's important to remember that there's multiple ways that we're trying to reach out to people. It's just not through the mass vaccination, because we know that one size does not fit everyone that we're trying to reach. Let me move on to some information in regard to Great Plates. That is, remember, it ends February 6th. We have not heard yet if that will be extended or not. It's important we believe, to make sure that our folks have a soft landing in this county, and we will continue that through the end of the month if, in fact, it is not extended. We typically hear the day before whether it's extended or not. So we're going to continue on down that path either way. In regard to additional events, we're trying to outreach as much as we can to folks and let them know, obviously ongoing, where our testing is and where our vaccinations are and how they can avail themselves of that. A lot of questions are coming up about the county and teachers. We're not in that tier yet, but that is not a population that we're charged with. Most of those individuals have private insurance. There is plans in place to work on that. And let's, for the video, why don't we go to the video, Ellie, and really show folks an idea what's going on.
Those things that I just read, as soon as we're done doing the swearing in, if you guys can head down to that office, we'll start working on the vaccine right away, okay? Please.
We're going to be setting up to your lanes. You want to start the first appointments at 10 a.m. It's going to be busy in the morning. People come early. They have a 1 o'clock appointment. They're going to be here at 9:45.
Yep. I have alcohol here, so.
Oh, you do? How about 1 ml?
I can give you some. We have plenty.
Okay, great.
We've got to make our kids proud.
You have to get it on whatever side of the
So they can't get
They
out.
cannot, yeah, they can get out. So
We have
follow that car! Follow that car!
What? A moment.
All right, just come from work. Have to go back.
Yellow back!
Okay, so we just want to give you some insight into what that looks like. You saw a very slow period of time there. It is amazing when we have, thousands of cars going through there in a matter of hours. And they just do a great job. It's really down to a science. But again, I mentioned that is not the only path forward. There's many different paths in HPSM and One Medical pilot programs going on. HPSM is working with One Medical on a pilot to provide vaccination appointments for those members 65 and over. And outreach by HPSM is ongoing with support from the county. The San Mateo Medical Center vaccinating patients age 75 and over at the Ron Robinson Senior Center. And that was on January 27th. And they hosted a curbside event on the 30th. And then certainly the vaccination efforts are ramping up this week. Daly City clinics start vaccinating on February 4th tomorrow. They are currently outreaching to patients, scheduling into 3 mass vaccination clinics at the San Mateo County Center. That's the one you just saw there through the 5th. So we're trying to outreach as many different ways as possible. The IHSS support workers, we've vaccinated about 28% of those, of the almost 6,000. And the events center, a drive-through clinic on 65 and older, again, is going on this week. So I know you guys had some questions, so why don't we jump into some of those? The first question, how will vaccine shipments into the county be affected by Blue Shield taking the lead on distribution? I can tell you that I don't think we have any idea. Sarija, do you know, have you heard anything else about this?
We don't have details yet on what the Blue Shield arrangement will mean for us. We do understand that each Blue Shield and Kaiser will be playing even more prominent roles directly with the state. And the major healthcare providers are really essential partners in this for our residents. If you look on our dashboard, Kaiser and Sutter have each vaccinated more than 10,000 residents so far out of the around 67,000 who have been vaccinated. So we really are welcoming the leadership and involvement of every level of government and our major healthcare partners to try to have the reach of the vaccine go as absolutely quickly and safely as possible.
And they're all constrained with the same issue about doses. I mean, I think that everyone is ready to go. Everyone is ready to ramp up if those doses are freed up and start flowing from the feds to the state, to the counties, to county entities, and all the providers. But I did want to comment and congratulate Sarija and her team on the dashboard that they've put in place in regards to vaccinations. I think it's really comprehensive. I think it really is one of the leading dashboards probably in the Bay Area, in that it breaks it down as far as who's getting vaccinated by race and ethnicity and age and a variety of other things. And I just think that's so important that we have that information available. So thank you, Sarija. The next question, has the county recognized any hesitation receiving the vaccine from phase 1 healthcare workers? And are there any figures available quantifying how many individuals have turned down accessing a vaccine? Sarija.
We likely will have more information after next week when most second dose efforts are completed. I would say that in the experience of our healthcare first responders, that was one of the first groups to be vaccinated. The acceptance rate was quite high. The hesitancy or refusal rate was, I believe, below 10%. And each healthcare provider entity is learning, because sometimes in the second dose, you get more folks coming for their first dose. They see that their colleagues have weathered the vaccine. The experience from others has continued to be good. But we just do acknowledge also that some populations, it will take more time to have that confidence and comfort with the vaccine, and we have to keep at it for a little bit longer.
Great, thanks. Okay, on to the next one. Sarija, this is one for you also. How's the county keeping track of the number of individuals being vaccinated in congregate care facilities through Walgreens or CVS?
Well, we were pleased to learn from the state that the federal pharmacy partnership data is now flowing into the state's immunization registry called CARE. And that's the source of the data that's on our dashboard. So as that catches up, our dashboard will reflect those figures. Dr. Chabra gave us an update that, more than 90% of the 500 plus facilities have been scheduled as part of that pharmacy partnership. Almost all have had their first doses delivered. And by next week, that will definitely be the case, with many moving into their second doses these coming weeks. The reach of that partnership has been more than 7,000 so far. We do have many, many facilities, many residents and staff touched in that really important setting where folks have shouldered a lot of exposure and vulnerability. So it has gone quite well in the last few weeks.
Great. Next one, with hospitalizations ticking down, what now is the county preparing for, predicting, and what's on the horizon? I'll just say that, we've learned a lot about COVID, but certainly we don't know everything, and that's what's concerning. We have no idea what new strains are coming or how this will mutate, and that's why we're asking everyone to continue to be cautious and not have parties and not gather and not let your guard down. It's just so important for our future as individuals and as a county that we all see this through to the finish line. And where that finish line is, I don't think anyone knows. Certainly the vaccine is a bright light and gives us great hope. But we don't know, what the outcomes will be yet. We just don't know. So we've got to make sure that everyone continues to do what they can and be vigilant. Sarita, your thoughts?
Yeah, I would just reinforce what Mike relayed and then share a couple things. I believe it was last week, Mike, that you extended the agreement for the augmented ICU capacity. That's a partnership between the county and Dignity and AMI. We certainly are heartened by some decline in COVID hospitalizations. Overall, our hospital partners continue to see, a lot of strain. They're quite full and have been on the front lines for so long. There are other illnesses also that this winter season has required hospitalization. So it was our commitment to extend that capacity so that we can have those strains be mitigated somewhat over this next 30-day period. And as Mike relayed, with the variants and while the rates have gone down, they're still quite high. If you look at our dashboard and what the curve looks like, this is still a period of widespread transmission. Hospitalizations typically lag a couple weeks. So we're ever vigilant and needing everyone in the public to remain right there vigilant with us, taking those precautions that you may be tired of hearing, but still very necessary.
Great. Next question, what motivated the county's decision to lift a hiring freeze on the San Mateo Medical Center? So it went beyond the medical center. I've lifted it for the entire health department. And looking back, part of this was really to make sure that we were somewhat circumspect in the hiring process, and we put in process a waiver process where individuals, departments could ask for a waiver. Well, I received, I think, 368 from health, and I approved 361 of them. So obviously, I have faith in them and to do the right thing. We're in tough financial times. The health, already had a deficit going into COVID-19, which was significant, and we try our best. But certainly, have the absolute faith in health to hire the right people. I did not want to delay any hirings because especially, during this time of crisis, they're needed on the front lines. We need nurses, we need techs, doctors, we need everyone associated with the health profession in their place in helping people. So that's why it was removed back as, I believe, right before we headed into the surge. We'll, I think they've done a very good job of hiring people and getting them in place. Considering the COVID-related financial losses, how will the new positions be factored into the budget? Well, these are positions that that are needed on the front lines right now, we're going to have to take a look at the budget as we come out of this and adjust accordingly. The health was using some reserves to augment their budget. because they had a great plan in place. I think that would have been very, very successful had we not headed into this crisis. And they've done a very good job of managing through this. So I think that we'll know more as we come out of this and where we are financially and how long the recovery will take. And we will budget and manage accordingly. With that, let's see if there's any questions.
Sarah Wright, your hand's raised.
Sarah.
Hi. First question is, have any vaccine appointments that you guys know of had to be canceled in the county because of a lack of supply?
From the county, Srija, I don't think so. I mean,
So for the vaccine clinics that the county has operated, either on our own or with a partner, we've really managed the appointment process so that we're only offering appointments based on the supply that we have allocated to us. You likely heard about cancellations that some of the larger healthcare entities have had to do. I read about the Kaiser situation at the Santa Clara facility when they didn't receive the supply that they expected. And I'm not aware of that happening from one of our major healthcare partners operating in San Mateo County, but each of them manage their own appointment process and what they can make available based on the supply they receive. And for the bigger providers, that supply is coming directly from the state. The county does not have a role in that.
and at our mass vaccination centers, as a matter of fact, we are so cautious to not, lose any of that product that we have people on standby, and they typically, these are people that we call during the day based on no-shows for appointments, and we have them on standby, and they are there to step in and make sure that every dose that we've thought is utilized and stuck in an arm. So it's a great process, and it's worked very, very well. Now, we always don't get to those, in the standby line, because some of them we may have not enough doses, but we have been able to get more people in that way by making sure that we have people lined up ready to go if in fact we have no-shows.
Got it. And then is it possible that deaths continue to grow even while cases and hospitalizations start to reduce because the new variants are possibly more deadly? Do we know anything about that?
I'll say a couple of things. And in general, the fatalities lag the hospitalizations, as you could expect. And so we have, as Mike pointed out, seen many more fatalities with this last surge than any other time in the pandemic. And it is very humbling and very sobering about the toll of this disease and its seriousness. And we don't expect that we're out of the woods yet, unfortunately, given the high transmission rates and still significant hospitalizations. In terms of whether that is traceable back to one of the variants, we don't have information to tell us that at this point. The research that I've read about the variants has to do with their increased transmissibility, how contagious they are, not their fatality impact. But I'm sure the scientists will be learning more, and we in local public health will continue to learn from the science that emerges.
Thank you.
Great. Next question.
Henrietta Burrows, hand raised.
Henrietta, how are you?
Henrietta, are you there? We can
I'm
jump-
so sorry. Sorry, I thought I was unmuted.
That's all right.
That's okay.
Yeah, I'm fine, Mike, thanks. I thought I heard you say, Mike, that it was the county that makes the distribution, and then I thought Sarija just now said the county has nothing to do with it. It might come from the state to the health providers. Do you know how those allocations are made, how it is that maybe some health providers get more and others less?
No, I don't, and we certainly do not get the honor of doing the distribution. I wish we did in some ways, but no, we have. I mean, I don't think there's a clear formula for any of us to really understand how the distribution goes. But we get our allotment, which then we give to, I don't know, Sarita, maybe 30 other organizations that will also take care of safety net members. And those who don't, have other means to get it. But, Kaiser gets their own allotment, Dignity, HPSM, AHMC, and certainly Sutter PAMP. So I have no idea. I don't think there's even a lot of transparency on how much individuals are getting. But Sarita, do you have more information?
Yeah, just to clarify, Henrietta, because I can totally understand that it could have been confusing. For the major they're called multi-county entities, the largest healthcare providers that operate in many counties, the allocation is directly from the state to those entities. And as Mike said, we don't have visibility on the formula that's used. And that is certainly something that we expect the new arrangement with Blue Shield and the direct involvement of Kaiser with the state might alter. With the smaller healthcare provider entities, Safety Net, smaller physician practice that's just operating in San Mateo County, the county has a distribution role of getting vaccine to them so they can vaccinate their eligible patients.
So how then does the county make that allocation to those to whom it makes the distribution?
Yeah, we have several considerations in making the allocation, largely based on who they can vaccinate, and that effectively getting the vaccine to patients in a reasonable time frame could be accomplished. We also very much prioritize, as part of our equity framework, those serving the most vulnerable and with the most exposure. In the last week, for example, about 50% of our allocation went to safety net healthcare providers such as Ravenswood Family Health Center, Northeast Medical Services, Gellert Clinic, the San Mateo Medical Center. When we have some supply that's allocated to us, we try to make it more predictable for those smaller providers to get to an eligible population and be able to outreach and reach that population without, in a matter of days, scrambling to figure out how to get vaccine to their patients. That's not always possible. If we only receive a very small supply, we don't have very much to redistribute to those smaller providers. And then we also consider the role we can play in vaccinating, such as this drive-through clinic that is operating for Health Plan of San Mateo members on Friday, as well as 65 plus age residents who haven't had a pathway through their healthcare provider. So it's a balancing act of many factors, trying to achieve reach of the vaccine safely and quickly, as well as prioritizing the vulnerable who are our core population for which the county has responsibility.
Just one more follow-up question. For those who do not have a clear pathway through their providers that the county is vaccinating, do those people have to be San Mateo County residents?
Yes, they fill out a survey form that's on our vaccination webpage. It's the precursor to the My Turn platform that the state will be rolling out to all counties, we expect in the coming weeks. But there's a few pieces of information we need from folks, including that they're a San Mateo County resident.
Okay, thank you.
And Henrietta, you bring up a good point. I hope that the Blue Shield will recognize the fact that, especially in our case, that we have found an effective way and through various pipelines to get the vaccine out in a mass way using different alternatives. So we hope that's recognized, and we hope that will lead to more supply.
Thank you.
Next question, I see Stephanie Sierra's hand is raised.
Yes, Stephanie, good to see you on here.
Hi, Mike. Yes, so two questions here. First being San Mateo County is one of only 2 Bay Area counties releasing race and ethnicity vaccination data. So the first question is, how did the county manage to release this data so quickly? And secondly, the preliminary figures show close to 40% of vaccines have gone to white people and less than 10% have gone to minority populations. So how is the county prioritizing equity within vaccine distribution?
Srija?
Hi, Stephanie. So in order, the team that worked on our dashboard prioritized many different things, but certainly the equity consideration has been very important to San Mateo County's mitigation from the very beginning. And knowing the disproportionate impact of COVID-19 on populations of color and our low-income population, having data by race ethnicity was something that we prioritized to make available to the public. The data comes from the immunization registry. So how we were able to do that has to do with extracting information in some ways the state makes possible for county level data teams. I don't know enough about the other surrounding counties or other counties in California as to, what barriers there could have been. I would say that we're really pleased that the completeness of the data by race and ethnicity has been pretty good. It's less than 10% that don't have race and ethnicity complete. So that gives us more confidence in displaying that data. For example, with testing data early in the pandemic, I believe it was close to 40% of testing data had that field missing. So it didn't give us as much confidence in displaying the data because we didn't know what was in there when it was missing. In terms of the benchmarks that would be relevant with an equity consideration for those who have received the vaccine so far, I want to just caution that the eligible populations so far have been certainly healthcare workers, and then now the beginnings of the 65 plus population. So the relevant reference point, it's a really important question, how equitable is the reach, would be what is the race ethnicity makeup of the healthcare workforce, and what is the race ethnicity makeup of the 65 plus population. It hasn't been possible for us to understand that from the workforce segments, and we hope that researchers like in the UCs and others will enable us to understand that reach as we continue to work on getting the vaccine to every eligible resident.
Thank you both.
Great, thank you. Any other questions?
Yes. Let's see. How does the county decide on allocation of vaccine to various health providers?
I think we just answered that.
Okay. I don't see any other questions. Let's see. I think we answered those ones. And there's a question asking for an update on the COVID business compliance team. How many businesses have been visited, warned, cited so far?
I think we've had 1,800 complaints. Thank you. I'm sorry, 1,300 complaints with 88% abated. Let's see, we've written many, it doesn't say the number, many citations and issued to date citations worth a total of $32,000. We're happy to look up that number and get you the amount of citations we've actually issued.
And the next question asks, any idea how close to completion the county is in vaccinating healthcare workers?
Sarita, you'd have a better handle on that.
I don't have the numbers off the top of my head. We have made great strides with healthcare workers, as have the major multi-county entities, which is what made us comfortable moving on to the next eligible group of 65 plus. It will take some time to parse back how many healthcare workers did every vaccinating entity and what data is available by occupation. That's not something that was super easily available to the major healthcare entities. They don't typically know that about their patients for every kind of service that they make available.
Great.
And the next question asks, through conversations with multi-county entities and the push to return to school, when should teachers realistically expect to be vaccinated?
Well, I think that's really dependent on the tier system, and as it stands now, they would be in the next tier a lot. Is that correct, Sarita?
That is what we understand. We would be looking to the state to move further into the 1B tier 1 that has 4 groups of essential workers, educators, childcare workers, food and grocery, and law first responders. It is also dependent on supply because the 65 plus group in our county has around 130,000, and we've reached about 22% so far among the major healthcare entities and certainly the county safety net role.
And the vast majority of them are insured, medically insured by private providers who would be responsible for that. Okay, that's it. Thank you so much. Listen, if you can just help us amplify, it's great to, if those folks want to cheer on our local star football player here, Tom Brady, in the Super Bowl, but do not do it in groups. Stay vigilant. Do not let your guard down. It's still very active. The virus is still very active, and we look forward to the day when we don't have to reiterate all that again. So thank you all for being here with us. Really appreciate it, and stay safe. We will see you back in 2 weeks. Take care.